China has announced sweeping changes to its tough zero-COVID policy. The National Health Commission unveiled 10 easing guidelines covering everything from lockdowns to the frequency and scope of testing. It's the clearest sign yet that Beijing is preparing its 1.4 billion people to live with the disease.
For nearly 3 years, China has pressed on with its zero-COVID policy, enforcing lockdowns, mass testing and travel restrictions. It's a bitter pill that has hurt the economy and just 2 weeks ago triggered protests across the country. Now, Beijing appears ready to soften its stance.
随着奥密克戎变异株致病性的减弱，疫苗接种的普及，防控经验的积累，我国疫情防控面临新形势、新任务。
Under the new guidelines, lockdowns will be limited to as small a scope as possible. The frequency and extent of PCR testing will also be reduced. People with mild infections can isolate at home instead of government facilities. They'll no longer need to show a health code to enter most public buildings. No negative COVID test results needed either for travel between regions.
优化呢新冠防控措施的目的之一，就是为了降低疫情对人民群众正常生产生活的影响。 通过有效的资源配置，重点保证重症和高危人群的救治，更好地统筹新冠防控和正常的医疗服务，更好地满足人民群众的健康需求。
Residents in Beijing welcomed the easing, but some fear an uptick in infections.
但是同样，因为大家不做核酸，那么就会导致一个结果：如果有人被感染了是阳性的话，我们其实是不能及时发现的。
我觉得对于这方面，我到现在为止没有太多的恐惧了，因为很多人都说了，这就跟平常感冒那个差不多了，所以说我也感觉没有太大的那种恐怖，没有害怕。
There are signs that China is not quite ready to live with COVID just yet. Vaccination rates of the elderly remain low, and its healthcare system is seen as ill-prepared for a wave of infections. New modeling by Wigram Capital Advisors shows that 1 million Chinese are at risk of dying from COVID-19 during the coming winter months.
And Lo Min joins us for more. Min, of course, we heard these 10 easing guidelines, which will then have to be reinterpreted by local authorities. So when can we expect these new measures to actually come into effect? And when they do, where does that leave China's zero-COVID policy?
There's no clear mention of when these policies will take effect, but how things generally work in China is that the central government would come up with these announcements and then it's up to local officials to implement them. So what's wrong in the past is that some of these guidelines are vaguely worded and open to interpretation. That's why different places ended up having different rules. But now this new 10-point plan appears to be quite specific. So hopefully that would clear up a lot of those confusion coming from this patchwork easing of rules over the past week. China has not explicitly said that it is shifting away from zero COVID. They are framing this as a further optimization of COVID-19 policy. And these rollback of measures appear to be accelerated after those widespread protests. President Xi himself reportedly acknowledged the existence of this protest and that people are unhappy with COVID curbs. That's a change in tune from what China's top security chief said last week, that these protests are fueled by hostile forces. That's code word for sources of external interference. Tuesday's Politburo meeting also suggests that there's going to be a shift in priority towards growth next year. We are hearing less of this old slogan of people first, life first. Instead, the Politburo is emphasizing a different slogan, stability first, and seeking progress in stability.
Oh, Min, stability first, which for some, it might worry them, including experts, who think this rollback is coming too quickly. What is at risk here?
Yep, some experts are suggesting that this shift away from zero COVID appears to be gearing up for failure because it's too rushed. China's elderly vaccination rate is still very low. At some places, less than 50% of the elderly above 80 years old are fully vaccinated and boosted. And with the winter months coming, people are likely to gather indoors where the virus is likely to spread more quickly. So by some conservative estimates, China could see 700,000 deaths the virus is left unchecked. But that's assuming that all those who need critical care can access them. And we know that China has very limited healthcare and critical care facilities, especially in the rural areas. So higher estimates suggest that China could see 2 million deaths. Earlier this week, the government had approved 3 new locally made vaccines for emergency use only. But all 3 vaccines are still under phase 3 clinical trials. So experts are saying that these last-minute approvals appear to be an ill-prepared strategy for exiting from zero COVID.
Oh, thanks for that. Lo Min Min reporting live to us there.